Thank you, Commander Friday. I appreciate that. And I want to thank VFW for hosting me here, having me here, and I also want to thank you for putting this on for the community. These health fairs and these awareness programs really do make a difference, and we're really glad that they occur in our community here. So what I'm going to do is, I won't take too much of your time. I'm going to tell you a little bit about myself, a little bit about why I'm here, and I'm going to talk to you a little bit about two cancers which are very prevalent, not only in this area of the country, in Petersburg, but especially for our veterans. And then we'll wrap it up, and as Commander Friday said, we'll have a few questions and see if we can give you some gifts out of it. Okay. I'm actually, am I speaking too loud for anybody, or can everybody hear me? You get it? Okay. All right. So I was actually born and raised up in Ottawa, Canada, and ended up doing my medical school in Maryland, and did my residency in internal medicine down at the University of Florida in Gainesville, where I actually had the opportunity to work at one of the busiest VA hospitals throughout my residency. There in Gainesville and in Tampa are the two busiest in the country. And so I got a good chance to kind of see what a lot of our veterans face and some of the diseases that are prevalent in that population. And then ultimately came up to the University of Virginia and did my hematology and oncology training, and that's what I do now. I decided to come over here to Petersburg and working at Southside Regional Medical Center. So at Southside Regional, they are very progressive and forward-thinking. I wasn't here when the old hospital was around, but I'm sure many of you had been to the old hospital and had experiences there. And if you haven't been to the new hospital, it's an absolutely phenomenal building. It's state-of-the-art, very nice. And I think the progressive and forward-thinking of Southside Regional and the administration is really helping the community. We are lucky enough now, we've broken ground on a brand new cancer center, which will be opening up in August or September of next year. And that's going to house radiation oncology as well as medical oncology. I'll be on the second floor. And women's imaging for ultrasound mammograms. So it's going to be quite a nice building, and it's going to be right next to the hospital, hopefully making it easier for our patients who need cancer care in the community to have one-stop shopping, basically. And they also realized one of the reasons that we're opening up this cancer center and that they brought me on here as an oncologist to see the patients is a lot of you felt that maybe you had better options up in Richmond, you know, and you would make that trip and travel to get your care up there or elsewhere. And we wanted you to know that, you know, you can get high quality, advanced standard care and gold standard care here right in Petersburg. And the rates of cancer, lung cancer, prostate cancer, colon cancer, unfortunately are higher in this part of the state. And why that is, it's under investigation. But until we find out why that is, we need to be able to offer you proper screening and proper treatment for all of these things. So the first topic I want to talk to you a little bit about is on prostate cancer. And I'll speak fairly briefly on it and give you a little bit of background on it and some of the things that we can do to prevent it from happening. Maybe dispel some of the myths out there about prostate cancer. And maybe asking you some questions a little later about it. So, just to let you know, it is the most common cancer in men in the United States. Okay? So in 2012, there was estimated to be about 240,000 new prostate cancer cases, which is terrible. Out of those 240,000 new cases, we're going to have about 30,000 men die from prostate cancer. So it's quite a significant health issue. Now, one thing that you should know, and that is a great piece of news, is if you are diagnosed fairly early in your prostate cancer, the 5-year survival rates for men with prostate cancer is nearly 100%, meaning you're going to be alive in 5 years and longer if you just catch it early enough. But the problem is, a lot of men don't get screened when they should, or they wait for symptoms, or they kind of blow off the symptoms that they feel. And the other unfortunate part is sometimes prostate cancer does not give you any symptoms until it's fairly advanced. But I'll tell you what, even if your prostate cancer is advanced, or even if it becomes advanced in the patient, we have so many different therapies that the standard survival is much better than many other cancers that we have out there. I will be talking after this just briefly about lung cancer, which is a much different story than prostate cancer. So what I really want to convey to you all, for your families and for you to pass the word along to perhaps the family members that aren't here, is the importance of screening. Women hear a lot about it for breast cancer, But prostate cancer sometimes doesn't get the same coverage, and it's just as an important problem. Breast cancer is the most common cancer for women in the country, and prostate for men. And I'm sure you've seen NFL on Sunday. Everyone's got their pink on, their pink cleats, their pink jerseys. You know, everyone. It's very out there for breast cancer. So we have to make it more aware as well for the men out there for prostate cancer. Which, by the way, the color is baby blue. For that ribbon. The stages of prostate cancer, just like any cancer, can go from stage 1 to 4. And I will tell you, even with stage 4 cancer, there are very good treatments out there for patients. And sometimes people associate chemotherapy with cancer. And I will tell you, for prostate cancer, chemotherapy is the absolute last thing that we would do for you when you have prostate cancer. There's so many other things that we can do that are not chemotherapy, that are easier on your body, that are easier to tolerate. And many people don't realize that. And sometimes it's simple treatments, just like hormonal treatments. Sometimes it's only radiation. And that can really last you for years and years and years of therapy. So I've had patients myself at the University of Virginia when we were treating them who came to me with metastatic prostate cancer, quite a devastating diagnosis, and they're alive 10 years later. Okay? So we need to really realize that if we catch these things early or treat it properly, you can live a long, healthy life and do very well. So there are some new treatments out there which may not be out in the media as yet, and I wanted to let you know about that. And these are new treatments which have come about for patients. As I told you, we do chemotherapy really as the last line of therapy when nothing else has worked. Now we have new therapies which are not chemotherapy, which are pills you take at home, which we can give to even after patients start progressing on chemotherapy. So if you know patients or have personal experience who are battling this disease, please let us know. There are other treatments out there. Besides clinical trials, we have just regular medication which you can just take at home, which we have great response rates. So we are making progress in the world of cancer. Everyone's looking for a cure for cancer, but unfortunately every single cancer from head to toe is a little bit different, which is why it makes it very difficult to just have a quote-unquote cure for cancer. So we take each cancer separately and research it, and luckily now in 2012 we're making progress. Just want to get the word out there that there's all kinds of different treatments available for people. Moving on to lung cancer. Lung cancer is not the most common, it's actually the second most common for men and also for women. However, when it comes to cancer deaths, as in people dying from cancer, lung cancer is number 1. All right? So I told you, you could have patients with prostate cancer who are diagnosed with metastatic prostate cancer who go for years and years and years and live a long, healthy life. When you have metastatic lung cancer, which unfortunately the risk factors, as you know, smoking, exposures to different chemicals, exposures to different work chemicals, all of these things lead to a fairly aggressive cancer. And lung cancer in general, if you have metastatic lung cancer after 5 years, the likelihood that someone will be alive is less than 10%, almost less than 5%. Okay? So it's quite an aggressive disease. And what you should know is when someone tells you that they have lung cancer, or you hear about somebody with lung cancer, you need to be able to separate non-small cell lung cancer and small cell lung cancer. Because they're two different types of conditions. So when you hear in the news, oh, such and such with lung cancer, or statistics on lung cancer, ask yourself, is this non-small cell or is this small cell? And it'll kind of give you a better sense. Even if you just look it up, not only in books, but on the internet, you will see that small cell lung cancer is very, very responsive, but it comes back and it can spread to the brain, and it's very aggressive. Non-small cell lung cancer takes a lot longer to treat, but once you get rid of it, it's pretty hard for it to come back. Okay? So it's important to kind of distinguish those two. The other thing is non-small cell lung cancer patients can get surgery or cure, whereas small cell lung cancer patients do not get surgery and get mainly chemotherapy and radiation. Now certainly if a patient comes to us and they have cancer that's spread to other parts of their body, their bone, their brain, elsewhere like in the liver, usually those patients just get chemotherapy. Now I will tell you, just as in prostate cancer, we have progress, and we have now medications which are not chemotherapy, pills you take at home, which can be used to treat metastatic lung cancer. And in fact, I just had a patient this morning actually, who we're planning on treating with this pill, It has none of the side effects of the chemotherapy, and it works even better and prolongs survival even longer. So we need to just be aware of these things that are available, and you know, sometimes your primary care doctors who see you a lot may tell you or may tell a patient that they have metastatic cancer, but not really fully know what kind of things are available. So it's really important that we educate ourselves, do the research, come to a center where we have advanced care, wherever you choose to go. It doesn't have to be SRNC. If you want to go up to NCP, you want to go to an academic center like Sloan Kettering in New York, wherever you want to go. Just make sure you get out there to get the information. And our job as physicians is not to force anybody into treatment or make you do things you don't want to do. It's really just to give you information and allow you guys to make a decision on your own. Okay? All right. So I will kind of finish off a little bit with things about screening and survivorship. So in terms of lung cancer screening, I told you for prostate cancer, we generally start advising men to have prostate cancer screening at age 50. And I kind of shake my head about it because there aren't really hard and solid rules about when a man should have prostate cancer screening. We know women get breast cancer screening starting at age 40, earlier if there's a family history. Well, with prostate cancer, we haven't found evidence that screening saves lives. So what we have now as our guideline is if a patient comes to us and asks us, I would like to have screening for prostate cancer, there's no question about it, we do it. And if patients are coming to us over 50 years old and have not even thought of having prostate cancer screening, we bring it up and tell them what the benefits are. I will tell you, prostate cancer, unfortunately, is more prevalent and more aggressive in African American men, and we don't know why, but it's another reason that, especially in this community, people need to be aware and get screened early. Now, there are certain exceptions. I talked about age 50. Some patients need to get screened at age 40 for prostate cancer. That's recommended for African American men. That's recommended for you, whether you're African American or not, but have a relative who has a first-degree relative, like a brother, an uncle, a dad who had prostate cancer. You probably want to get screened about 10 years earlier than the age of 50. Okay? Lung cancer screening up until 2011 was not recommended, and now we've got new evidence to say that patients who are heavy smokers, so heavy smokers is basically categorized as people who have what they call 30-pack year histories of smoking or more. A pack year is basically 1 pack a day for 1 year is 1 pack history. So if somebody has smoked 1 pack per day for more than 30 years, or if you do the math, 2 packs a day for only 15 years, those patients need to be screened with CT scan. And a CT scan now, it's a low-dose CT scan, so the radiation is very minimal. But we've seen a 20% reduction in death from lung cancer in patients who are screened, who are appropriate. So up to 2011, there was no screening, and now we do have screening available, which is approved, which is Pt.4 by all insurances and Medicare, and it is saving lives. So I just wanted to get that word out there about that.